Skin cancer is a terrifying thing, but if detected early enough, can be managed. Watch as Dr. Thompson helps this man close up a large wound left on his cheek by removing the cancer to begin with. Here on The Younger You.
I'm on top of the world and now I'm living, and the good just gets better, keeps on giving. Not even close to the end, it's just beginning. Life is getting lighter while the days are getting brighter, yeah. And it's a good, I won't even worry anymore. Took all my cares, took and kicked them all out the door. Go on and try, come and tell me what you're waiting for. Move and keep on going till your life is overflowing, yeah.
Welcome to The Younger You. Today on the show we're talking all about the most common and abundant type of cancer that exists, and that is skin cancer. Each year in the US, nearly 5 million people are treated for skin cancer, and 1 in 5 Americans will develop skin cancer in the course of a lifetime. On the set today to discuss the important topic with me is double board certified facial, plastic and reconstructive surgeon, Dr. Scott Thompson from Utah Facial Plastics. Welcome back to the show.
Thank you.
Okay, for everyone at home, I want you to explain to people, what is skin cancer?
Skin cancer is just a condition that can develop in the skin to varying degrees where the cells are growing abnormally, and it becomes cancer when we say the cells are malignant, which means they can grow and cause damage to other areas of the body and surrounding areas where they start.
Okay, now I can only assume in layman's terms there's a lot of different types of skin cancers, and how do they vary?
There are several different types of skin cancer, and the most common, fortunately, is the least aggressive. So most people that get skin cancer, it's not a life-threatening thing, but it is something that has to be treated. And then the most aggressive kind, everybody's heard of melanoma. That's the one that can really be aggressive and can be a killer at times. Okay,
so how do we know we're developing skin cancer to begin with?
In general, if anything develops on your skin that's new, that you haven't noticed before, that doesn't seem to heal, or that bleeds or scabs, or if you have a mole that changes colors or starts to have irregular borders or pigmentation, those are things that should be checked out, usually by your dermatologist first.
Oh, okay, so you'd go to a dermatologist first. What does he do for you when he's
checking it out?
The dermatologist,
is someone that sees you kind of on a routine basis to do maintenance skin checks, especially if you have a history of skin cancer. Mm-hmm. And then depending on what is found, if there's something that needs an aggressive treatment, then a lot of times they'll be referred to someone like myself.
Okay, so how do we notice? So you say mole color difference. What about those, what we would assume are aging spots? So when we're self-diagnosing, which everyone does,
right.
You know, you see a few brown spots come up on your face, don't panic, that could just be aging.
Right, it could just be aging, and people ask me on the street all the time to check
Really?
something if they know what I do, you know. And it can't hurt to just have your doctor check, and it may be something that isn't worrisome at all. Okay. And you're exactly right, age spots, there are other things that develop that are not cancerous. But we don't always know what those are unless we kind of get them checked out.
Okay, well, can you get skin cancer on other parts of your body? Now, we have heard, me being from Australia, people get it on their back from being out in the sun all the time as well. Is it possible to get it on your legs, or?
Yeah, it can develop in very unusual places that you would never expect. But in general, the sun-exposed areas are the most common places to get it. But just because it's in an area that doesn't see a lot of sun doesn't mean that you can't develop skin cancer in that area.
Interesting. Is it a hereditary issue?
It's partially genetic. So yeah, if you have a family history of skin cancer, or particularly melanoma, that's something that we would want to know about. And yeah, it's a combination of environmental factors, or the sun, and genetic factors.
Okay, so what do you do if you know it's a genetic factor? Is there anything that you can do to prevent it?
Always, whether you have the genetic history or not, you want to protect your skin from the sun. And usually a zinc-based sunblock is the best thing to use. And then, it's just important, if you have the history, then you get checked regularly. And if something pops up, or something is different, or something changes, you have your dermatologist check it out.
So when it becomes a problem, okay, your dermatologist sends you to someone like you, okay, as the patient. And does the dermatologist cut the skin cancer out, or are you doing that?
It depends. There are lots of different techniques that are used for this. I tend to work closely with a surgeon's called Mohs surgeon, and that's a very specific technique for removing skin cancer on the face. And when we do it that way, generally speaking, the patient comes to me with a hole in their face. The skin cancer's already been removed, and then I'm fixing whatever's left.
All right, Dr. Thompson, I have so many more questions to ask you, but we brought some questions to the people on the street to see how well they know the facts about skin cancer.
False?
False.
We're gonna have to say false, but I have a feeling I'm wrong.
Oh wow. I know our cancer rates in Salt Lake are pretty high for skin cancer.
I've never heard that before, so.
Wow, that's shocking.
I'm going to have to go with minute.
I'm gonna say every hour.
I think either minute or hour. I'll say hour.
That's all surprising information.
100%, yes. I hope that means I'm going to be cancer-free.
Welcome back to our conversation on the crisis of skin cancer. Now, treatment of non-melanoma skin cancers increased by nearly 77% between 1992 and 2006. So we know it's a growing issue. Now, of course, we're joined again by Dr. Thompson. I want to go back to the question that I asked you before the break regarding prevention of skin cancers. Now, there are so many lotions and potions out there that we get at the supermarket and the pharmacy, 30 plus, 50 plus, zinc creams. Break it down for me.
So the simple answer to that question is anything SPF 30 or greater is effective, and that's what I tell my patients. You don't need to feel like, oh, I need 100 because this one's only 50. 30 or greater is great. Now, I tend to recommend that people use zinc-based sunblocks because those are a sun block. It's a physical barrier versus a sunscreen, which uses just a chemical to kind of filter the rays out. A sunblock blocks all the light out, and that's what I want with my patients that are healing up from, surgery. And in general, I think it's a better sunblock.
Okay.
Use sunblocks and sunscreens.
Well, that's what I was just about to ask you because, I know Australia is up there when it comes to skin cancer and issues for around the world. I think we're leading, #1 in the world for skin cancer issues. And you see all our lifesavers with these big white zinc marks over their face to protect their skin. Now, do all zincs look like that?
No, and people ask me that all the time. I don't want to use a zinc because is it the white? And these days they have it formulated to where it's called micronized, so it comes out white, but then it rubs right into your skin. You can't see it at all, and it doesn't have that kind of visible barrier.
Does it surprise you that Utah is in the top 12 of the world for skin cancer?
Not at all. I mean, we live at a higher elevation. There's lots of sun. I mean, how many days of sun do we have a year here? Yeah. So many. And there are so many light-skinned people that live in this area that we're just really, I think, susceptible and exposed.
Okay. On average, because you do facial reconstructive work as well, for cosmetic procedures, are you seeing a lot more coming into your practice for skin cancer issues, or is it declining for you?
Well, I've seen a lot since the day I started my practice. It's very common, and most people, I think, go to the dermatologist first, but I get lots and lots of referrals for skin cancer reconstruction, and many times they're very involved and very extensive defects. And most of the time, those are people that have a lot of times neglected it a little bit, and so it's become a big problem. But sometimes they haven't. Sometimes you just can't tell, and then all of a sudden you have this big hole in your face, and you were going to your dermatologist regularly. It's not always easy.
It's a frightening thing because it's a visual issue as well immediately, like you were saying.
Right.
Why haven't we learned?
Well, I mean, there's this idea that having a little bit of pigment in your skin looks good, and it does look good.
Get a spray tan.
And so, right, yeah, that's really the answer. But I try to tell people, especially women, if you protect your skin, long term it looks so much better than if you spend a lot of time in the sun, because you just age so much faster when you do that.
Look at the beautiful alabaster skin on English men and women.
Right.
Beautiful, because
Right.
they literally don't go out in the sun.
Right, and so, it's not just a skin cancer problem. It's also a cosmetic problem.
Yeah.
So.
Dr. Thompson, thank you so much for your answers. It's fascinating, and I've got so much more to ask you. But we've got to head over to our interview with Renee and see what factors have led to her condition and see why she needs the cancer removed.
I'm Renee and I'm 65 years old. I had some skin cancer on my nose and some on the top of my head. I actually had a kidney transplant about 6 years ago. And when you have a transplant, they turn your immune system way down. And so that makes you more susceptible to skin cancers. And so they watch very closely to be sure that nothing's developing with that. So I see a dermatologist every 6 months, and he found these 2 spots that concerned him and sent in a biopsy, which came back positive. And so then I saw a microsurgeon yesterday who removed all the cancer, but the damage was too extensive for him to repair. And so now they've sent me on to Dr. Thompson, who's a plastic surgeon, to repair my nose and to put my scalp back together. My dad is bald, and he roofed houses when he was young before sunblock and worrying about keeping covered up. So he had both sun damage and immunosuppressant to deal with. So he has way more problems than I do, because I really am not a sun worshiper. Don't spend a lot of time in the sun. Relief yesterday to see the microsurgeon and be sure that he was able to get it all. However, he had to go deeper than he had anticipated. And so now we're down to some cartilage here on my nose instead of just on the surface. And so that's why I need this procedure today. The next part is just getting me back to a presentable position, and so I'll get through this and move on.
Coming up after the break, we're going to watch Dr. Thompson in action as he performs the repairs needed for Renee. Closed captioning for The Younger You is brought to you by Mindful Medical. Looking for the perfect beauty product? Each week, The Younger You highlights a standout product in the health and beauty industry. Head over to theyoungeryou.tv and check it out. Love to hear your comments. The following footage contains surgical procedures. It may be too graphic for some viewers.
So skin cancer, as we all know, is really common, especially in this area that we live where there's a lot of sun and a lot of fair-skinned people. I see a lot of skin cancer in my job, and there are different types of skin cancer, but they're very common on the face because that area is exposed to the sun all the time. So Renee has 2 skin cancer defects that we're going to be fixing today. And one is up here on her scalp, and this is the hole that was left after they removed, someone else removed the skin cancer, what's called a Mohs surgeon, and they have a very specialized technique for removing skin cancer.
What we have is a genetic disease. We have a genetic kidney disease, and so I inherited it from him, he inherited it from his mother. One of my daughters has inherited it from me. So we knew it was coming and knew eventually we'd be in the position to need a transplant. So my sister gave to my dad 27 years ago, and this is my aunt, and she gave to me 6 years ago. And so we had plenty of time to think about that and knew that was coming. And you just know that if you do that and have your immune system suppressed, you're going to have more of this kind of problem. So I didn't need a lot of time to think about it now because it just goes with the territory.
Once a diagnosis of skin cancer is made, there are different methods that we use to treat the skin cancer, but one of the commonly used methods is called Mohs surgery. It's M-O-H-S, the name of a surgeon that developed this technique. And a Mohs surgeon is a specialized dermatologist that removes skin cancer, and we use the Mohs technique on the face a lot because, for example, if you have a defect on the nose, we only want to take out the minimum amount of skin that we have to take out to get rid of the skin cancer. The traditional way is to take a wide piece and say, okay, you know, I'm going to take an extra ½ inch on each side to make sure I've got it all out. But you start doing that around the eye or around the nose, and suddenly you have a really difficult problem to deal with. And so the Mohs technique is able to remove the skin cancer in a very precise, mapped way so that we really just get the skin cancer and not much else beyond that.
She did ask me if this was going to give her a free facelift / forehead lift, and it actually might lift her brow just a little bit. Probably not a lot, it's kind of far back from the front of her forehead, but. And then once we do that, her scalp is not a particularly loose, lax scalp, but when you get under here and free all this up, that'll really help it to move.
The Mohs surgeon specializes more in removal of the skin cancer, and so when there's a defect that needs to be repaired that's a larger, maybe a little bit more complicated defect, then the Mohs surgeon will call me and I'll see the patient and we'll fix it. And so yesterday when Renee showed up in my office, she had 2 holes in her face already, one on the nose, one on the scalp, and so we kind of talked about what our options were for fixing it, and that's where we are today, is fixing those 2 defects.
What they'll do today is, because the cut is so deep on my nose, they have to fill that in. So they're going to take a piece of tissue from my cheek and turn it around and attach it where the hole is on my nose. And then they'll leave that attached for 2 weeks while it grows its own blood supply. And then I'll come back for a final procedure where they completely attach that to my nose. So I'll have about 2 weeks with this strange setup on it.
Generally speaking, most people are concerned and distressed by having a hole in their face, and so we try to get it fixed as quickly as possible. It's okay if we wait. Sometimes if someone's a smoker, I'll insist that they stop smoking and we'll wait for a week before we fix it, because it just really increases the chance that it'll heal well in that situation. So we're here with Renee today, and we did a pedicle flap repair on her Mohs surgery, about 3 weeks ago, Renee? And that's what this is right here. This is called a pedicle flap. And this tissue right here is connected to her nose from her cheek. And that's what this scar is right here. This scar is red and raised right now, but that will flatten completely and just blend in with this fold. It'll be tough to see. But this cheek skin was stretched up here to cover a hole on her nose. And we had to leave it attached to the cheek for blood supply purposes. Now it's been about 3 weeks, and amazingly, the nasal skin grows new vessels into this cheek skin, and so now we can come back and disconnect it from the cheek, and it'll look like it's supposed to look again.
When we come back, I get to sit down with Dr. Thompson and Renee together to go over her procedure and her final results. Renee, welcome to the show. You absolutely look amazing.
Thank you.
How do you feel?
Really good.
Really?
Really, it was great.
Isn't he just the best surgeon?
He is. There's no question. No question.
Okay, Dr. Thompson, we're just about to take a look at the cancer that we had on the nose. How severe was that for Renee?
It was severe in that it involved a fairly large portion of the tip of her nose down to the cartilage, so it was a little bit deeper, and certainly could have been worse, could have been into the nose, into the inside, and that makes it much more complicated, but definitely a tough place to fix on the end of the nose.
Well, let's stay on that just for the moment, because we also had another skin cancer issue on top of her head, but I just want to show everyone at home also at the 3-week mark, at how it actually looks when you've repaired it compared to now. Right. Where did you get the skin from to begin with?
So when it's down on the tip of the nose like that was, and it's deep, it's actually tough to repair it because there's no skin close by on the nose that we can use without really distorting the nose. And so we borrowed some skin from her cheek and swung it up to cover the nose, and it actually remained attached from the cheek to the nose for about 3 weeks for blood supply purposes. And so looks really weird there for a few weeks.
Were you thinking when Dr. Thompson said to you, we're going to take it from your cheek and move it up to your nose, and then 2 weeks in you thought, what is this on my... Did you feel like it was ever going to go away?
It was really strange. It looked like he'd sewn a finger to my nose.
Exactly, that's what I'm looking
at
myself.
Like I was just with the finger stuck there.
Yeah. How long did you need, can I call it a skin graft?
It's called a flap, is
A
what
flap?
it's technically
Okay,
called.
how long is that there for?
So in this case, we usually leave those attached for about 3 weeks before
Okay.
we can go and divide it. And usually you have to just kind of wear a big bandage over it. And they're not all that way, but for one like this, that's really the only way to fix it well.
How did you know that you had skin cancer?
I didn't. I thought I just had a little sore on the end of my nose
Really?
that wouldn't heal. I've had a kidney transplant.
Oh.
And they warn you when you have a transplant to be very careful about skin cancer.
Fascinating.
Yeah, higher
And-
risk in a
Why is
transplant
that?
patient.
Because they suppress your immune system after the transplant.
It's a good thing she went in because she is a little bit more susceptible, and not only did she have the one on her nose, but they also found one on her scalp that
And
was cancerous
Let's
too.
talk about that one on the scalp as well. How did you discover that?
Actually, I did.
Oh, you did discover.
I could, my hair's very thin on top, and I could feel a bump there. Couldn't see it even when I looked in the mirror, but I could feel a bump. So when I was at the skin doctor, I said, oh, by the way, I've got this bump. Would you look at that? And so then he biopsied it, and we moved
Okay.
on from there.
Where did we get the skin for
the
the
scalp.
scalp?
The scalp, we don't usually want to take skin from somewhere else because then you'll have a big bald spot on your head where there's no hair. So generally speaking, if I can, I pull that together with the scalp
Oh,
that's
gotcha.
there. And so that's what we did in this case, and it's filled in really nicely. We were just looking for the scar and having a hard time seeing it.
Were
so
you
it's healed
thinking
up
when
pretty
he
well.
was pulling the scalp together that it would lift up your face as well?
Oh, I was hoping. I was hoping so much. But he let me down on that.
Yeah.
Dr. Thompson, what I wanted to ask you, and I'd like you to chime in on this, how severe was her condition and how long would it take for it to become life-threatening?
Right. It all depends on what type of skin cancer it is. If it's
Gotcha.
the more common basal cell cancer,
It was.
which hers was, and most of the time it is, those are generally slower growing, but sometimes they can be a little bit more aggressive. If she, given how big the hole was she had
Yes.
after just noticing it for 6 weeks, if she'd waited a couple of years, she probably would have had to have a big portion of her actual nose removed, and that becomes a very challenging reconstructive problem.
Well, how do you feel that you actually discovered this and had someone like Dr. Thompson work his magic?
Very blessed that it wasn't worse than it was. And
Is it something that was in your mind at all throughout the years?
well, I think it was a little bit because my father has trouble with skin cancer.
Okay. Hereditary.
And so I've been aware of it from that. But my nephrologist is very careful about warning me all the time.
Well, I can just say, Dr. Thompson, look, sitting here right beside you on set, I had to ask you where the scarring was because you truly do look amazing. Thank you for sharing your journey. We truly appreciate it. Dr. Thompson, incredible work. We're going to put more information up on our website as well. If you've ever had the misfortune of developing skin cancer like Renee or any other condition that affects the appearance of your face, then Dr. Thompson at Utah Facial Plastics may be the man that can give you back your beautiful appearance. And remember, protect yourself from the sun. It's the best way to ensure you never find yourself having to deal with skin cancer. For more information about the show, please visit our website at theyoungeryou.tv, and I'll see you next week. Coming up next week, we'll be meeting with Dr. Dunkley and taking a look at a procedure that we will add some perkiness to your breasts and shape them to the size you want using implants. Dr. Dunkley, I just want to get something across the line to begin with.
Okay.
Is it common practice to have a breast implant when you have a breast lift? And why is it best to do them at the same time? The Younger You set provided by Madison McCord Interiors.